Hello, my name is Sayani Ganguly. I hope you all are doing well. Today I'm presenting a special awareness video about importance of breastfeeding for mothers and their babies in the honor of Nutritional Month with my co-partner Abhigya Chakraborty. I hope you enjoy this video. So let's start. Breastfeeding is the feeding a neonate or infant with breast milk directly from female human breasts, not from a baby bottle or other container. Breastfeeding nourishes and feeds a baby in a natural way. A mother's milk is the first thing a baby wants. It forms a great bond between the mothers and their child. Experts recommend trying to breastfeed exclusively for 6 months. Breast milk is the food naturally designed to best meet the needs of human babies. It has all the necessary nutrients in just the right amounts and is easy to digest. Beyond the nutritional benefits, breast milk also helps build and support babies' immune system. Breast milk has 3 different and distinct stages: colostrum, transitional milk, and mature milk. Colostrum is the first milk your baby gets when you start breastfeeding. This first stage of breast milk production begins during pregnancy and lasts for several days after the birth of your baby. Approximately 2 to 4 days after the baby is born, transitional milk replaces colostrum. Transitional milk is thin and white and contains high quantities of fat, calories, protein, lactose, and vitamins. Many mothers notice the quantity and consistency of their milk changing about 2 to 3 days after their baby's birth. Approximately 10 to 15 days following baby's birth, the production of mature milk begins. Mature milk primarily consists of water and it often appears bluish in color at the beginning of the feeding, foremilk, and turns white towards the end of the feeding, hindmilk. As the milk's fat content increases, the consumption of hind milk is essential to ensure the baby is getting adequate nutrition. The letdown reflex is what makes breast milk flow. When your baby sucks at the breast, tiny nerves are stimulated. This causes 2 hormones, prolactin and oxytocin, to be released into your bloodstream. Prolactin helps make the milk, while oxytocin causes the breast to push out the milk. The letdown reflex makes the milk in your breasts available to your baby. Cells around the alveoli contract and squeeze out the milk, pushing it down the ducts towards the nipple. Oxytocin also makes the milk ducts widen, making it easier for the milk to flow down them. The letdown may happen if you see or hear your baby or even just think about them. No matter what position you use to feed your baby, it's important to get a good latch. It takes practice both for you and your baby, but a good latch will help you feel comfortable and help your baby get the most milk. The first step is tickle your baby's lips with your nipple. This will help the baby to open their mouth wide. The second step is aim your nipple just above your baby's top lip. Make sure your baby's chin isn't tucked into the chest. The third step is aim your baby's lower lip away from the base of your nipple. Baby's lip should be turned outward like a fish. Your baby should lead into the breast chin first and then latch onto your breast. Your baby's tongue should be extended and your breast should fill your baby's mouth.
The mother should wear comfortable apparel so baby should be properly positioned to achieve effective latching. The infant's mouth, chin and umbilicus should be lined up with the head in a neutral position. The infant is brought to the breast with the nose touching or close to the breast. Large black portion of breast and nipple including milk collecting ducts are inside baby's mouth. Tongue under the teeth. Few different position and technique can be helpful for mothers are sideline position, football position, cradle position and cross cradle position. Breastfeeding mother need additional 330 to 440 calories per day which give them energy to produce milk. A lactating mother need a balanced diet and during this time it's important to keep well hydrated. So 6 to 8 glasses of water or even more when breastfeeding. As milk is their only source of nutrition, so during this time, a variety of vegetables, fruits, grains, protein, a little bit of fat which helps to make more milk. Breast milk contains live immunity that he or she receive both immediate and it feels close to mother that they have known while in the womb. DHA polyunsaturated fatty acid found in milk which helps to support proper brain development. Also, breastfeeding can reduce chances of developing allergies in babies. Breastfeeding saves money and time, and hygiene is at the highest level. It enhances bonding that promote motherly behaviors and help baby feel safe and loved. Women who breastfeeding longer have lower rates of type 2 diabetes, high blood pressure and heart disease also. Breastfeeding mother may suffer some problem like sore nipples usually happen because baby is not well positioned and attached at the breast. Infants may also have difficulty latching on correctly to nurse when nipples are flat or inverted. Failure of milk to come in by 4 days postpartum due to maternal illness. It's impossible for breastfeeding mother to know how much exactly breast milk their baby is getting with each feed. But if they are having nappies at least 6 to 8 hours and their urine is pale and not smelly, that means breastfeed baby is getting enough breast milk. They are also having a steady weight gain when averaged over a few weeks, and in the first few months they gain a lot of fat. Breastfeed babies who are getting enough breast milk do not become constipated.